Good morning, everybody. For the record, my name is Bob Haynes. I'm the president of the Massachusetts AFL-CIO. And unions have called this press conference this morning to make clear our views on municipal health insurance and offer our own answers to the problems caused by rising cost of health care. First, Paul Toner, the president of the Massachusetts Teachers Association. Paul?
Thanks, Bob. I'm Paul Toner, president of the Massachusetts Teachers Association. Let me start by saying that we, the representatives of a cross-section of public employee unions, recognize that health insurance costs are continuing to rise at an unsustainable rate and that this is having a negative impact on public services, especially during this recession when revenues have been hit so hard. Although unions and our members did not cause this problem, we intend to be part of the solution. My role here today is to summarize our proposal. This plan is not yet in bill form, and there are some details yet to be worked out, but all of the unions here today are in agreement about the basic principles. Before I summarize our proposal, I need to set the record straight. The Massachusetts Teachers Association and other public employee unions have been at the table for the past 7 years seeking a solution to the problem of escalating health care costs. We have been offering and accepting changes to our health insurance plans at the state and local levels. In 2007, we backed the law that finally permitted municipalities to join the Group Insurance Commission. After that measure passed, the MTA devoted considerable time and resources to educating our members about health care issues and helping them analyze the different options available to them. As a result, many groups of employees have bargained changes to reduce costs, including those 31 cities, towns, and other governmental bodies that negotiated agreements to join the GIC. Our critics have accused us of dragging our feet when it comes to discussing the kinds of changes that are still needed. In our experience, a shrinking number of municipal leaders even approach us to negotiate changes. Some have gone so far as to turn us down when we have asked to discuss going into the GIC or bargaining cost savings in current plan designs. I don't mean to sound cynical, but some might think the municipal leaders are holding off on making reasonable compromises now in hope of keeping the pressure on the legislature to give them the authority to make unilateral plan design changes in the future. Whatever the reasons may be, we have reached a point in this era of declining revenues where a large number of cities and towns are still struggling with high health care costs. This is having an impact on services we provide and on our members' jobs. While no one likes to give up hard-won benefits, we recognize that some reasonable limits on municipal health care costs are necessary. That is why we are here today announcing our collective support for a proposal that will bring approximately $120 million in cost savings while at the same time protecting our right to bargain over the specifics. Here are the details of our proposal. We are proposing a one-time process for all municipalities and unions to go back to the table and negotiate healthcare savings at the local level. First, we propose establishing a predetermined health insurance cost benchmark that municipalities and their unions will have to reach. Municipalities that are already in the GIC or have comparable plans which already meet these benchmarks won't have to enter this one-time process. If municipalities believe they have already achieved sufficient savings, even though they may be above the benchmark, they do not have to enter the process. And a municipality can also decide not to go all the way to reach the benchmark. This is a decision for each local community to make. Second, all municipalities and their unions will adopt Section 19 coalition bargaining, which allows all municipal unions and retirees to negotiate over the specifics of the new plan as one unit rather than having municipalities negotiate with multiple unions. Third, the unions and municipal officials will have a 45-day period to bargain specific plan designs or conditions for entering the GIC, with both sides understanding that spending has to be within the benchmark limits. Fourth, if no agreement is reached, an impartial third party will be asked to make a final determination about whether to achieve savings through making plan design changes or to call for having the municipality join the GIC to achieve these savings. Fifth, we believe that either in legislation or through regulation, it should be stated that the cost savings will be split equally between the city or town and their employees. The savings that would go to the employees must be used on health programs, such as health reimbursement accounts or HRAs, wellness programs as well. The ability to establish an HRA is essential to alleviate the burden produced by the shifting costs onto employees through higher co-pays and deductibles. The public needs to understand that the only way to find substantial savings and to meet our proposed benchmarks is to significantly reduce premium costs. The only way to reduce premium costs is to shift the cost of services to the employees through higher co-pays and deductibles. One of our primary interests is to protect our members and those in their family who have chronic illnesses or costly medical conditions. Without HRAs, they could end up having their very high out-of-pocket costs. Sixth, we have supported and continue to support requiring all Medicare-eligible retirees be enrolled in Medicare. This is an obvious way for municipalities to save $30 million, but some of them still have not adopted this mandate even though it's been available to them. Finally, our seventh and last proposal concerns the GIC, of which I am a commissioner. The GIC offers many fine plans and options for its enrollees and has managed to keep premium costs lower than we have seen in some municipalities. However, the public needs to recognize that the GIC has been able to do this by shifting costs to employees, establishing a tiered system of services in hospitals, and conducting aggressive negotiations with insurance providers. This has negatively impacted employees who are most in need of medical treatment. The reluctance of some municipal unions to enter the GIC is based on concerns that the sickest among us will be hit the hardest. It also relates to the GIC's decision to make unexpected mid-year changes in plan designs last year. In order to give municipal unions more confidence in the GIC, the Commission must guarantee proposed rates and plan designs for any given year. We also need more labor representation on the Commission itself. We propose a 50-50 split between union and non-union representation. I want to close my remarks by noting that the MTA and other unions represented here helped to organize 2 rallies outside this building within the last 2 weeks in support of Wisconsin public employees. Like our counterparts in the Midwest, we are willing to make sacrifices to protect jobs and vital local services, including education and public safety. But our members have made it very clear that they wanted this message delivered. Leave our collective bargaining alone. The MTA and our local associations have a long history of finding solutions through collective bargaining. In the process, we have built the finest public education system in the country. We call on municipal leaders to meet us halfway and support the plan that we have announced this morning. After all, compromise and flexibility for the greater good are what bargaining and democracy are all about. What we've proposed is an expedited collective bargaining process with a time certain that's going to happen right now in this spring and hopefully give seasoned towns the needed savings they need immediately. Not a dragged out collective bargaining process. If they can't get it done at the local bargaining table in 45 days, our proposal is to have a neutral party sit down and make the final decisions through a dispute resolution process. I also want to make it clear, we're coming to the table, but we also want to make sure insurance in Massachusetts is still insurance. Insurance is supposed to take care of the sickest among us, and unfortunately, more and more with the insurance plans that are available to public and state employees and private individuals in Massachusetts have higher deductibles, higher co-pays, and it's making it very difficult for our lower-income employees to be able to go get the services they need. Period of time that collective bargaining will be limited to, for health insurance, to getting to yes on finding savings.